Sweet. Welcome to this Ask Me Anything. And one of the things that I've been working on right now with clients is this idea of introspection. Um, we all feel what it's like living in our bodies, okay? But some of us feel things a little bit more than others. So this idea of introspection, it's that idea of how you can feel what's going on in your body. And some of us have shut things down or not been attuned to it for so long that it's really hard to tell. One of the best examples I have is that feeling of having to go pee, right? Going to the bathroom. And at some point, sometimes we shut things down so much, we ignore the sensations in our body, we push through pain, we push through these things, and our body, the interoception in our body gets to the point where we can't tell anymore. And you don't feel like you have to pee until your bladder is so full that you are bursting and you need to run to the bathroom. Okay. So one thing that I work on with clients, especially when we've been living with pain, is this idea of introspection, of being able to calmly pay attention to how the body feels, right? And that's a big part because if you've seen a couple of my other videos, you've seen that we do somatic tracking within treatments, okay? And somatic tracking is that ability to pause, to notice a sensation, and to be okay with that, right? To be okay and be calm. And whether it's back pain and you didn't really do anything, but now your back is acting up and you can notice it, know that you're safe, know that it isn't tissue damage that needs to be looked at right away. It calms the nervous system. And a lot of times it calms those sensations. So when we look at introspection and you've gotten to the point in your body where you've pushed things away so much due to whatever it is, we need to start figuring out how to reconnect with that. And one of the best ways that I've learned so far to reconnect with that and build on that level of introspection is somatic tracking. All right. Now, there's a flip side to this because everything has a flip side. And with this higher level of introspection, sometimes we get hyper vigilant, right? We become so obsessed with trying to figure out every sensation in the body that any sensation in the body becomes a thing to pay attention to. Your body has so many nerve endings and so many movements and so many joints, muscles, all of this different tissue that we need to understand that your body's not going to be perfectly comfortable all the time. But we want to get to the point where we know we can feel and we can connect to a sensation of being okay. And it's from that point of being okay and noticing that and recognizing it that we start building on that path back to wellness. Okay. So, like I mentioned, this introspection idea, it's something that came up when I was sitting in on a special interest group for functional neurological disorders. And it's something that it's caught my ear in the past. So I've been doing a little bit more dive into it. It's really interesting. So it does build on everything else that we've been working with of how to pay attention to how things work. And it's one of the things that we look at when we're doing yoga therapy, because the yoga therapy that I teach, we look at building awareness. We look at paying attention, how the body feels. We connect to the breath. Okay. We use our exhale to find that sensation of being grounded. We use our inhale to find a sensation of finding some space, lightness. Different parts of the body are going to respond differently to one part of the breath or not. Okay. And then we build movement. When we build in that movement, it's acknowledging that there's muscles that are working, tying into that sensation of a muscle functioning. And then we tie it into the concept, the feeling of the muscle relaxing. So we build up and then we just keep building on that. We build a little bit more complexity. We build a little bit more load. We build a little bit more range, depending on what we're working on, depending where your body goes. There's a whole thing. With that, I just want to tie this in. I am teaching a 6-hour training at the end of March. It's March 21st and 22nd. It's going to be an in-person training. So if you happen to be in Calgary and you are a health professional and you do either all the time or occasionally or even possibly in the future, we're going to be working with people who are living with persistent or chronic pain. I highly recommend this course. I know that makes me sound kind of biased, but one of the things I've been doing for the last 3 years is teaching a back care yoga module for Alberta Yoga College when they do their teacher training. And it's a 3-hour module. And we start by looking at why back pain is so prevalent, right? And we look at the structural versus neuroplastic level of back pain and what can be playing a part. We look at different situations. But within all these trainings that I've been a part of, there's always the question of how do we learn more, right? And I typically say, well, you could go to the NOI group. They've got some great information and amazing books and everything. You can go to pain reprocessing therapy. You can go to, I did my pain mentorship with Core Kinetic. There are different things you can do, different books you can read. But I wanted to put something together that tied more into it. Right? So this 6-hour training is going to be based off of everything I've learned. First, it is not a be-all, end-all training. I do want to build more off that so that there's more of a mentorship that we can work on, but it's a really solid start. It's a 3-hour class on the Friday evening from 6 till 9. It's a 3-hour class on the Saturday afternoon, 1 to 4. Beforehand, you're going to get a couple videos just to watch if you want to catch up on things that we're going to talk about. Okay, that idea of structural versus neuroplastic, that idea or the diagnoses that you're likely going to hear, in particular with back pain. Pain is such a complex thing. We could be talking about it for a long time. But this is going to be a 6-hour program. Right now, it is valid for 6 PDCs from the Alberta Kinesiology Association. I am working on getting it recognized by a few other associations in Alberta and in Canada. But if you're in Calgary, and if there's any chance you're going to be working with clients or you are working with clients who live with persistent pain, I highly recommend it. And when I presented all this stuff in the last couple of teacher trainings that I did for the yoga training, highly, highly excited about that. So with that being said, that's about all I have today. Okay. We want to be able to give ourselves the chance to listen to our bodies. We're so used to pushing things away, pushing through things, that we start losing that ability to notice calmly and then decide from there. All right. So if you want to learn more, check out the rest of my articles, check out some of the videos. If you really want to learn more, you can subscribe to my Substack, low price every month. You get access to all the classes that I've taught in like the last 2 years. You get access to all the articles I've written. And I'm really hoping to continue building on that. Okay. Again, if you have any questions, please comment below. If you want to show up for the next Ask Me Anything, I would be glad to have you on here. Either way, thank you for watching, and I look forward to seeing you in the future.